Hello, good afternoon, and welcome to this webinar from the European Regional Center of the Lancet Countdown for Health and Climate Change. I'm Catherine Tunna. I am the co-director of the European Regional Center, and we're very excited to have this webinar today, which really serves two purposes. First, we're going to hear a bit about the sort of main messages that came out of the 2025 global report from the Lancet Countdown, which was published last week. And then we will have the opportunity to take a deep dive into one of the indicators from Working Group 5 that's basically included in the global report, but also the Lancet Countdown Europe report that focuses on tracking scientific engagement with health and climate change. So we're very excited. We have the indicator developers here to tell us more about how they have developed their indicator and really what it tells us. And then we will also have a roundtable discussion with the indicator developers, as well as representatives from two national organizations who can share their perspectives on what the findings from this indicator mean from their point of view in terms of informing national research agendas. So we'll go ahead and get started, and we'll kick off with an overview of the global report from Jennifer Israelson, who is a research fellow for the Lancet Countdown Global based at UCL. So over to you, Jennifer.
Hey, Catherine. Right, let's hope this works as well as it did earlier. Can you see that? I'm going to take that as a yes. Thank you, Jan. Lovely to be here. Thank you for inviting me. As Catherine said, hopefully everyone knows, last Wednesday we did launch the 2025 report of the Lancet Countdown on health and climate change. So this was the 9th annual report in the series, and it's the most comprehensive as of yet. This year we had 57 indicators in the report, and each a single data point year on year that collectively really capturing the impacts of climate change on health. So this report is a true collaboration. We got 71 contributing organizations from all around the world, as this slide nicely demonstrates. It brings together 128 authors, each of them experts in their individual fields, and the report is done in partnership with the World Health Organization. So the report here really shows that delays in climate change action are increasingly costing lives and livelihoods. We see that millions of people are dying each year as a result of our persistent over-reliance on fossil fuels, which leads to growing greenhouse gas emissions and our failure to adequately adapt to climate change. So with the hotter and drier conditions, climate change is increasing the risk of wildfires, which threaten both physical and mental health. So as we can see in this map, the risk of wildfires has increased in nearly all countries across the world. And deaths associated with wildfire smoke reached a record high of 154,000 deaths in 2024, a 36% decrease since the 23-12 average. But what we're really seeing in this report is that it's not just one risk that is increasing, but it really is across the board. So 13 out of our 20 risk and impact indicators reached new record in 24. And emissions from our food system keeps increasing, and unhealthy diets are associated with millions of deaths. So since the 2000, our emissions from agriculture has increased by 36%, and in 2022, 55% of all agriculture emissions came from red meats and dairy. In Europe, we saw about 2.7 million estimated deaths from unhealthy diets in 22, and over a third of those were associated with overconsumption of red meats and dairy. We're also seeing emissions relating to energy setting a new record in 2023, since 81% of the world's energy supply still comes from fossil fuels, and a large share of that is still from coal as well. And the burning of fossil fuels resulted in about 2.5 million estimated avoidable deaths from the associated ambient air pollution, with the transport section responsible for the largest share of those deaths. And we keep funding this, so our continued reliance on fossil fuels is straining national finances. The vast majority of the countries that we reviewed spent more on fossil fuel subsidies compared to carbon pricing, generating a net subsidy to fossil fuels by nearly $1 trillion. 15 countries that were included allocated more resources to fossil fuel net subsidies than it is to the entire health budget. So the backsliding on climate change action is really putting people in harm's way. Health adaptation keeps being underfunded, and adaptation is becoming increasingly costly and challenging with each unit of greenhouse gas emitted. So similar to the picture around risks and impacts, we see that most of our indicators on climate change and health actions are moving in the wrong direction, and 6 out of our 20 metrics actually showed a reversal of previously seen progress. So one of those metrics is the government engagement with health and climate change. In 2021, 62% of countries mentioned health and climate change in the UN general debate statements, whereas in 2024, this was down to 30%. And most of the countries that were still engaged were those that had contributed the least, but are the most affected by climate change. Private bank lending is also going in the wrong direction to fossil fuels. Fossil fuel lending increased by 29% between 2023 and 24. And although green sector lending also increased, that was only by 13%, so 80 billion more was lent to the fossil fuel sector. But all is not doom and gloom. We do see some positive things as well. So climate change action really offers a lifeline, and we can see the countries that have taken action are already seeing those positive impacts. One of those is on renewable energy. The percentage of electricity from renewables globally is now up to 12%. And associated with that, employment in the renewable energy sector increased by over 16 million jobs in 2023. And although we keep spending a lot of money on the fossil fuel industry, direct employment there actually fell. And the health impacts of moving towards renewables is already being seen. The reduction in dirty fossil fuels, especially the reduction in use of coal in high-income countries, already saving thousands of lives each year. Fossil fuel-derived air pollution has decreased over large parts of the world, Europe in particular, and leading to around 160,000 deaths avoided per year between 2010 and 2022. And not all some leaders are backsliding on commitments. Momentum is really building for locally led action. So local actors are stepping up where global leaders are stepping away. Cities and local communities are at the forefront of the health impacts of climate change and must be central to any adaptation response. In 2024, 97% of the cities included reported having either completed or expected to conduct a city-level climate risk and vulnerability assessment, although we can see that there's still a really large disparity between high and low HDI countries. The healthcare sector is leading the way in reducing emissions, which is really key since they are accountable for about 4% of global emissions. But they're also preparing for the impacts from climate change by completing vulnerability and adaptation assessments and health adaptation plans. So what this year's report really shows is that life-saving potential of climate change action. The backtracking of climate commitments clearly puts lives, health, and livelihoods on the line. So protect lives and health really requires all hands on deck. Thank you so much for listening to this presentation. You can find a lot more, of course, on the report on our website, where you can also find a lot of the data that's underlying the report findings. Finally, I would really like to thank our 2 strategic partners, so the Lancet and Wellcome. The Lancet Countdown was established in partnership with Wellcome, who continues to provide core financial support to this work. Thank you so much.
Thank you, Jennifer. It's great to see the really important indicator evidence coming out of the global report yet again, even if the message is very sobering. But we now have the opportunity to hear more from Jan Minx and Tim Repke about the indicator that they have developed on scientific engagement. So over to you, Jan and Tim.
Yeah, I'm also going to share my screen, but I just realized I think this should work, hopefully. Do you see a title slide that says Insights from the Scientific Engagement Indicators?
Yes.
Brilliant. Yes. All right. Yeah, so this is, I'm going to start with talking about our indicator, which is the one on scientific engagement. And then later on, Jan will take over and talk about how this fits into our bigger research agenda in the group and in our collaborations. And I thought it's an interesting an interesting way to maybe look at what is the motivation behind creating an indicator and what is the process for those who are interested in this, and highlighting some considerations that you might have to make this actually feasible. And then going into a little bit of the history of an indicator to show how our process was, and lastly finishing with some of the headline findings, and then handing over to Jan, as I said. Yeah, so maybe for those who are interested in or thinking about also proposing an indicator, I tried to, from my understanding in some consulting with Jan, list out the rough pathway to an indicator in the Lancet Countdown. Of course, it starts with an idea, and maybe this is based on a paper or a project that you're working on or have been working on. And you would say, oh, I want to update this anyway, so maybe I could continue updating this. So the way you would go about this would be, of course, contact the working group leads and co-leads, or discuss this idea with them. And the next step would be going into developing a, I think it's in this text called a white paper. It's kind of a proposal of how this indicator is supposed to work, and from the method side of view, and how you, where you put your focus areas. And this is also then peer reviewed. So, this is mostly an internal process, but also some external reviewers will look into this. You can then incorporate the feedback, of course. And it's not just a white paper that you file away, it's also we use this as the basis for our indicator appendix that we can then reuse and refine every year as we make adjustments to how the indicator looks like. And I tried to recap what the timeline was this year, because this might also be an interesting aspect for those who are interested in developing an indicator, how much time is involved in preparing the work, but also how long you are kind of involved in this. And I think it's not too much work, but it's also not negligible, depending on what your state is. In our case, other colleagues, especially Max Callahan, he was leading this indicator the last few years, so I took this over for him. And of course, I needed to get into this, but it's essentially, it's not much text, but it's depending on what is behind the text to create that text, right? The data set. But the first draft is around maybe February, March. I hope this is not the timeline that we already stretched, but the actual timeline, sorry. I'm spreading false information here, but it takes about half a year through all the different revisions, internal and peer reviews and final submissions and small changes and so forth. And separate to the actual written indicator and the appendix is also like a data sharing submission, which I think is really a very nice way of being open and transparent about what data we have, and also gives people who are more interested in the indicator ways to dive deeper and ask more specific questions. And I think we are quite open about this, but I will also talk about this later on, how we manage this. And there are, of course, some considerations that you should bear in mind when you propose a new indicator. Mainly is it sustainable in the kind of working environment you're in? Because I think an indicator is supposed to last more than a year, obviously. Otherwise, it's not an indicator that you can recap every year. So this has to be sustainable work for several years to come. And so you need the resources for this, the people who work on this with the expertise and so forth. And also, it's then worth considering how much work is it to actually update the underlying analysis or the data set or whatever you need to collect for this. But then if this fits your overall research agenda, then you can, of course, think about how does this benefit having an up-to-date data set all the time. In our case, we have the scientific literature on climate and health with categories and filters and so forth. And we really benefit from this because we have many projects that are around this ecosystem in a way. So yeah, this ecosystem idea could be a thing. Do you and your collaborators benefit from this, as I mentioned? And maybe also, are you planning to develop this further? If you have maybe other submissions in the pipeline over the next year or 2 or 3, then you might benefit from having kind of different sub-projects that always refine from the original indicator, and you improve this over time and also get additional publications out of this that are nice contributions to the science community. And also maybe it's worth considering, can your indicator contribute to other local indicators, not just to the global countdown, but also or the global report, but also the local reports. And in all this, I think thinking about the amount of work that you invest, think about automation. And this is kind of what I'm trying to highlight in the next few slides. And I don't know, sometimes we are kind of in our echo chamber. We call this living evidence, this idea of that you can regularly update and relatively easily update your evidence base. So yeah, the general workflow in our case is we want to collect all the relevant literature on climate and health, or at the nexus of climate and health. And we want to be complete in this, but of course, yeah, what is the scope? And we keep refining that scope idea, but it all starts with, of course, the research question and the protocol, but then it starts from, we need to get the actual literature. And by this, we usually mean we operate, for this at least, on the title and abstract basis. So we need the or bibliographic metadata from databases like Web of Science, Scopus, OpenAlex, you name it. And there we have a very broad query that pretty much, we hope, ensures that we get a complete picture, but also way more than we need. So in this case, I think at the moment we get 1.5 million records back that we then filter down to around 100,000 records. And for the Lancet Countdown specifically, I think we end up with 65,000, 68,000 records that are actually relevant for this scope that we clearly defined. And then we extract additional information, add classifications on, for instance, does this article capture mitigation, adaptation, or impacts of climate change? What kind of climate impacts does it mention specifically? What health outcomes does it mention? We extract location information and other things. And I put this small robot in there. This is kind of where automation comes in, and of course AI. I prefer calling it machine learning. It's less hype. But yeah, once you automate that step, you can then relatively easily just update this pipeline, depending on how much automation you put in this. But having the most labor-intensive part, the filtering and the annotation done by AI, is the only way to make this feasible. Think about annotating 100,000 abstracts. It's just beyond feasible. But of course, this tiny robot needs some food. And this is, we did annotate lots of data at some point, and we keep annotating this as we refine our methods. And we train machine learning models with this that can then do the classification and filtering and so forth. And aside from contributing this to the Lancet Countdown and writing these things up, we also have kind of an interactive website that people can explore the data. And this is also one outlet for this pipeline. And depending on how often you want to run this, in theory, you can do this every day as new publications come in. Yeah, this is just to illustrate. We have our human annotations on the left, then this long pipeline in the middle, and then it's on our website. Yeah. I noticed that I spent way too much time on this, so I'm just trying to very quickly run through how this indicator came to be. This all stems from our original publications on systematic mapping of global research on climate change and health, a machine learning review by Leah Baring-Ford and others. And yeah, as I mentioned before, this is on literature on climate and health, and specifically on the nexus, the overlap of these two bodies of literature. And we also, through follow-up work, tried to merge this data with kind of climate modeling and climate impact attributions, because we can extract location information from the text, and we know where in the climate models we see impacts, be it climate impacts or health outcomes and so forth. We can merge these into one more enhanced data set and run analyses on this. And this is kind of our second indicator that we have, which zooms in on this a little bit more at this intersection. We have some background information of what to consider. And I think one big learning is it's really, really hard dealing with the limitations of kind of the publisher world, because we can't even sometimes get the titles and abstracts of everything we need. So we started using OpenAlex, which is kind of an open database that contains this information, but unfortunately publishers are also starting to remove abstracts, and this is kind of a challenge for us to keep this indicator running in this kind of automated fashion, because we need access to the data, and ideally the full text, of course. Maybe also some other things beyond classification. There are kind of data-driven ways that help you to explore this so-called topic models. And yeah, it gives you kind of semantic clusters that you can then explore. We don't include this in the indicator, but this is just to give you an idea of what you can then do beyond that data. Some headline findings from this year. As you can see, over time, the number of publications is growing, and the biggest category is, or the largest body of literature in this context is on impacts. Last year, in 2024, the number of annual publications wasn't as high as the previous year in 2023, but it's still at a very high level, and we expect this to kind of continue. And what a trend that we can see in looking at the proportions over time is that there seems to be a shift, or like a stronger focus on adaptation literature, and this is also something we see when looking into where the literature focuses on in geographies and so forth. Really quick, also is a strong focus in the literature on the global north. Also, when you look at who's writing these papers, we looked at the affiliations and so forth. But these proportions are starting to improve. And by this, I mean, of course, that it's more balanced across the whole globe, but it's still quite out of balance looking at what the research is on, like which areas are mentioned. And lastly, from our second indicator on this intersection of impacts literature, the most mentioned climate drivers are changes in temperature, precipitation, and humidity, which is kind of the obvious impacts. And the most frequently mentioned health outcomes are mortality and morbidity, infectious diseases, and cardiovascular diseases. And in kind of looking through the trends over the past few years, we don't really see any particular trend in any direction. So this is relatively stable looking at the proportions. And sorry for rushing this, but I'm now going to hand over to Jan, and then we can have a few questions after. Do you want to share the slides yourself, Jan, or otherwise I will just go through this?
Yeah, I mean that also works. Hi everybody. Nice to see you. If you move to the next slide. Yeah, I just want to put this now into the bigger context of work that we are doing, also work that is funded mainly by the Wellcome Trust. It's a lot of work on living evidence, and I think what always fascinated us with the Lancet Countdown is that it's a form of living evidence. An annual update is also living evidence, and it's really, really useful. And we need this much more widely, because there's really a disconnect between the scientific and the policy world, because policymakers don't have the best available evidence available when they need it. And so the idea behind living evidence is to constantly update high quality systematic reviews and systematic maps in order to address this. And I will talk a little bit about some of this in the context of the Lancet Countdown. So bear with me a little bit to make this connection. Next slide. So basically, what we see is that even though this year, in climate and health, we see actually fewer publications than in the previous year, but overall, it's one of the main insight that like a strong trend that we see throughout the scientific enterprise, that there's an exponential growth on evidence, and certainly on climate evidence. And this basically means two things. One, we need the rigorous assessment of the available evidence is becoming more important. But it's also obviously an opportunity, and we need to develop methods that can address the scale of this, but also assess the quality, because many of us have a lot of concerns about the lack of quality of these masses of research. Next slide, please. And now obviously we also have AI, and Tim, even though he prefers to call it machine learning, uses a lot of this. Is obviously a candidate to help us rise to this challenge, but I think it's really important that we do this in a responsible way. Next slide, please. And this is what we are trying to do in the Destiny project. So the Destiny project is funded by the Wellcome Trust and sets out to co-develop a new generation of digital evidence synthesis tools. So basically tools powered by AI to help us synthesizing available evidence in climate and health, to showcase their transformational power for the delivery of rigorous living evidence in this field that matters to policymakers and other evidence users. Next slide, please. What does this, first the consortium. This is us at PIC with the group of James Thomas at the Epicenter and the Future Evidence Foundation, the London School of Hygiene and Tropical Medicine, Cochrane, Campbell, and also 3 African partners, ACRES, Ascend, and eBase. Next slide, please. And what we try to do is to develop new tools that help us actually as researchers, as also as users of evidence, to deal with this growing body of evidence and make evidence synthesis faster, cheaper, and more useful. But now the second bullet is super important. I think we see a lot of irresponsible use of AI in the context. So we are in a kind of an era of Wild West, I would say, even in the scientific enterprise. So what's important in Destiny is that we make that our users responsibly. And what does it mean? We want to ensure that digital evidence synthesis tools can be applied without compromising our well-defined methodological standards. And that requires a lot of evaluation. So that is also what we do. So we develop tools, we evaluate them, generate human-in-the-loop processes for their responsible application. And then welcome trust project impact through co-production. So this is also working a lot with decision makers, also using tools to help them accessing evidence much better. And we apply those tools then in 6 impact cases. And we want to mainstream the responsible use of digital evidence synthesis tools. This is where Cochrane and Campbell come in and make sure that good practice can be established in science with evidence producers, evidence users, but also evidence intermediaries. Next slide, please. For this, and this is now what where we meet the Lancet Countdown. We've created a living data repository for the Lancet Countdown, and this is basically more or less what you've seen, what Tim has shown you. So we have now a living evidence repository that is continuously updated. So we have different evidence data sources like OpenAlex, like Web of Science, but also a lot of gray literature sources. No. Yeah, okay, you can do it like this too. Yeah. And there are also trial registry, UN and government repositories, gray literature sources, curated data, local data sources. At the moment, a lot of this is still under development. So we are our main focus at the moment are still the bibliographic databases and making sure that this works. But we are adding those other components over time. Then we also, if you go back, we also want to make each of these records more valuable, and therefore we enhance the data further. So we, for example, want to attach a record or an annotation to each of the record, which scientific method has been used, what kind of outcomes are studied, what kind of interventions are being studied. And this is what we do through AI-enabled enhancements with the necessary involvement of humans. So there we are talking about human-in-the-loop processes. And then we have also the evidence use side of thing. And now you can go down 2 slides further, where we open, then this is supposed to be an open living evidence repository, where we will provide open APIs, discovery interfaces, mapping interfaces, evidence synthesis tools that can be used to summarize some of this data, etc., where you can do bulk export. Next slide, and this is where I will close. I think, so we are currently building such a system, and actually there are other brother and sister projects that are developing other similar repositories in other sectors within the same infrastructure. And I think this living evidence repository could be a big opportunity for the Lancet Countdown, because I think as we develop this further, I think we can actually, to indicator teams where evidence is basically provided through scientific publications, we can explore ways of delivering new evidence that is identified by the system to indicator teams quite specifically. This is nothing that has been discussed at a wider level in the Lancet Countdown, but this is something for me that it could be something that can be explored. And so in the different working groups, there could be actually quite a lot of synergies from having such a living evidence repository, as we are building it with other partners, and others are doing it in other sectors. But I would like to leave it here and close. Thanks so much.
Thank you, Jan and Tim. That was fascinating and really interesting to think about, future directions for how we could incorporate this type of work into the Lancet Countdown, and even, in a way, thinking of Lancet Countdown as a type of living evidence is, I think, a really, something I had never really considered before. So it's very interesting. We're now going to have the opportunity to discuss the work you're doing in more detail in a roundtable, and how this kind of evidence can be used for national level organizations. So we will have the roundtable discussion chaired by our Working Group 5 leads, and are joined by Paulo Nicola from the Portuguese Council for Health and Environment, and Professor Ana Maria de Roda Roosman from RIVM in the Netherlands. So looking forward to the discussion. Over to you.
Hello, everyone. So my name's Nahir Dasandi. I'm a professor at the University of Birmingham, and I'm the co-chair for Working Group 5, which this indicator belongs to, that looks at public and political engagement with health and climate change, both for the global and the Europe Lancet Countdown. Slava Yankin was also going to join me, but unfortunately he's been pulled out in a slight childcare emergency, so he sends his apologies. I thought what we'd start by doing is I've got a couple of questions for Tim and Jan, and then I've also got questions for Paolo and Anna. And then for those of you in the audience, if you're able to, if you have questions, if you're able to add them to the chat, I'll start to collect those as well, so we have a bit of time for this. So the first question, well, firstly is thank you so much for the presentation, Jan and Tim. My first question is actually, coming from a context where I get to see a lot more of what goes into the indicator than many others, particularly because in the final report the text is so short, as Tim mentioned, and there tends to be a lot of attention actually to a few key findings, and this can be around the global distribution of research production. It can be on the types of research. I wonder, given you have a bit of time to get into this now, what do you think is the most interesting trend and finding that the scientific indicator has revealed for you, that actually, and added to that might not get the attention that you think it deserves?
Yeah, well, thanks for the question. I think it's a really interesting thing, as you point out. You get this much text in the end, and then you spend, depending on weeks and months getting to these things. So I think it's a balance of two aspects. There is the data doesn't, or the analysis doesn't just sprinkle up something and you get to pick and choose. You kind of have to come up with ways in which you want to, let's call it, explore or interrogate the data. And then there is also, of course, the automation aspect. And that also has a very big influence of what we choose to actually then present in the indicator, to say, these are findings that we're very certain about, that this is actually a signal and not just an artifact of the machine learning being a little bit imperfect. I mean, that is the case. It's not perfect, but so you shouldn't look for tiny trends, but these need to be big enough depending on what quality you can measure. And that's kind of also the key point. You need to validate the machine learning models you are using, or the AI you're using. You still need the human annotations or some other validations to know how good is it. And based on that, you can create some numbers that you think could be interesting, looking at trends, looking at proportions, and so forth. And then decide, is this one thing that I just saw as a signal, is this within or kind of over the noise ratio, let's put it this way. And long story short, I think the interesting, for me, the most interesting trend in where the research is developing is that there appears to be a stronger, or it starts to balance in focusing on adaptation research more. And this has been a trend that seems to be going on for 4 years now. that this proportion is getting bigger, with the overall proportion still growing, but it was always very dominated and still is very dominated by impacts research, but we see this adaptation growing. And we also, which I find really nice and interesting, is to see that there are more authors also from low and middle HDI countries that contribute to this research. So this is a thumbs up for the funders, I think, but also keep doing this, because we do need also more research in these areas. And this is something we still see, that these are regions, especially in the global south, where we don't have enough evidence. And this is also something we are looking into as part of Destiny, to figure out together with partners all around the world, can we transfer knowledge from one area where we have enough to other areas based on, for instance, similarities of city characteristics or location characteristics and stuff like this. And yeah, and one finding that's always sticking around, can only iterate this enough. We can only do the research when we have the data, and the data in our case is at least some metadata around the publications and also the full text of the publications. And this is a huge amount of work that we even get to that very, very first step in our pipeline. And it's increasingly harder, which is a bit annoying to hear every year. Yeah. Anyway, I leave it at this. Jan, do you want to add something, or should we?
Right. Okay. My second question, and Jan, you touched on this in the presentation. Obviously, this is linked to wider work that you do on evidence synthesis and on this notion of living evidence in climate change and health. Can you maybe say a bit more about why you think it's so important? I mean, obviously, this is a huge amount of effort that you both and others in your team are putting towards this. Can you tell us a bit more about why it's so important we devote attention to this sort of evidence synthesis and this living evidence, and how it can, contribute to our understanding of climate change and health, but particularly, I guess, around climate action that protects human health? What contribution you feel this makes?
Yeah, there are multiple answers to this. So first of all, obviously I think it's important that we are evidence-based in general, and knowing where the evidence is a very fundamental first step. So that basically identifies or that relates to this work what we are doing here, mapping out all the research that there is. Because my feeling is we need to be efficient. We have so many global problems. We need to make sure that the solutions we go for are actually working, and that we also spend, for example, funding where it's most needed. And I think that's not often the case. If you look at research landscapes also, and we are also analyzing research grants, actually, there are always big clusters of a lot of money going into the same things, lots of research publications looking into the same things, and that's not an efficient system. So we need evidence synthesis, even at that scale in terms of the mapping. But then obviously we also want to know about, what is actually the best evidence on a particular matter. And in the climate community, we have done incredibly well, I would say, in terms of modeling. We have a powerful tool called intermodal comparison, where we've, using many models to really understand, can we replicate, with different models, with slightly different model structures, can we identify, this, or do we reach the same sort of conclusions? And this has, been an incredible success story within the IPCC, for example, and beyond in terms of climate science. I think we have actually not been doing well in terms of doing what people in health have done really well to understand more kind of empirical data. So coming from the climate, so I'm always talking here, I should say that for transparency from a climate perspective. And there, I think it sometimes depends, on who you are talking to, what kind of evidence will be presented to you. And I think that's not a good situation, but we have very powerful tools to make sure that we understand the evidence on an issue comprehensively. And that's particularly relevant when it comes to the effectiveness of policies. And I think you were talking about mitigation and solutions and adaptation. I think that's the area where I feel we need to do a much better job and really identify, which interventions are effective, how much do they cost, what are other side effects, what are health co-benefits, et cetera, et cetera. And I think that's an exciting, we are lacking also a lot of important primary evaluation research on this, but in certain fields we have enough, and we need to rigorously synthesize this because we want to base our decisions again on the best. We want to be sure that we know about the things we are acting on, and I think this is the critical role of evidence synthesis. It makes sure that we are effective. It helps us to also then adjust interventions, but it's also absolutely critical that we assess the studies themselves, call out bad studies in a transparent way, and enhance primary research at the same time. So I think there are many reasons to this, and sorry that I've taken so long, but I think it's something I'm very passionate about, and something that I think we need to address as a community and need to get better in.
Absolutely, thank you. And I wanted to bring Paolo and Anna Maria on that question too. So, the work that Jan and Tim and others are doing specifically focuses on this notion of scientific engagement and this role of evidence. From your perspectives as people that are also further in that sort of delivery chain in terms of that policy side, maybe you can reflect a bit too on why this is so important that we see this, and I guess particularly in the context Tim mentioned, access to data, what we're seeing, globally and particularly in the US, where we're seeing evidence being pooled and those sorts of things. What role that plays and why it's so important in this policy process.
Hello, thank you very much for the invitation, for this wonderful work that you've been developing, and you continue to develop with new perspectives and new tools. It's very exciting to be able to work on that. And just to make some context, so the Portuguese Council for Health and Environment is an independent, non-governmental organization with more than 100 entities from health professionals and others, scientific societies, Portuguese universities, faculties, hospitals, private companies, pharmaceutical companies, patients associations. So it's very broad organization that works to empower and to bring all these entities together in the area of health and environment. So one thing that we did was to set up an observatory and do a national report on many topics, and one of them was really research. What could we say about the research resources and agendas in Portugal and the entities that were dedicated to these areas, which are not many. But since then, we've been developing a mapping of our research agendas and projects, and who is doing what with what level of collaboration on what topics. And this comes very nicely to the information and the several classifications and dimensionalities that you included in this indicator. And thank you very much for not only all the presentation, but also the data that I went and looked for, the data that you provide by trends by country and all the topics, health impacts and exposure and so on. So we'll in the next report we are doing yearly reports, and the next report will be incorporating this data in our national discussion for this topic, not only of research, but we are also giving support to the experts that do these yearly evaluations at our national reality, with also bringing them what is the new evidence, what are the data that has been reported. And so we are doing at a national level a work that has many connections with your work. And we are also concerned with how to support the decision nationally, at municipal level, at different sectors, and how they can evaluate their programs and not only support their plans and their programs, but also evaluate their impacts. And so I see with much interest in the tools that you are developing to do it in a rapid way. In health, there is I see you collaborate, for instance, with Cochrane collaboration. So there is very good experience in providing quick and evidence synthesis analysis for decision making, and I think that we have this intersection of areas will be very rich. For now, I think this is how we will be using and looking very carefully at this indicator and bringing this to our national observation and national analysis.
That's great. Anna Maria, I wonder if you wanted to come in on this too, just that role of evidence and scientific engagement. I'm not sure. Anna Maria, we've lost you slightly, or at least we can't hear you. So I think you're still muted.
Is that better?
Yeah, that's much better.
Yeah, I've turned off my camera. So thank you for the comprehensive report on climate change and health. We have found in our context that it can be very difficult to bring health in the climate debate, even more so for infectious diseases, which is my background. And also, this is true for climate adaptation and mitigation. Apparently, people feel it's very difficult to understand the relation between any adaptation or mitigating for climate changes, and to see that it can indeed lead to infectious diseases. So what we found was that we had legionellosis cases approximately 6 kilometers away from the actual source that was very difficult to find, and it was because of greening of wastewater treatment plants. So this has been a real challenge for us, as one example. Oh,
That's great. Thank you so much. So I had a follow-up question, but I'm just going to remind people, please do feel free to post any questions on any part of the presentation, including, the indicated development side, which Tim spoke about too. So if you add them to the chat, I will pick them up, or feel free to actually raise your hand, and we can just try to have a bit more of an open discussion, even though it's online. But as a sort of follow-up question, and this is something that both Jan and Tim spoke about, and so actually they may also want to come back in on this. But Paolo and Anna Maria, one of my questions was just around. So one of the things I've been contacted about on the scientific indicator is I think people are often surprised, or I think surprised is the right word, at the amount of research that's done on health impacts of climate change relative to other forms of climate and health research, and particularly, mitigation related research and adaptation. And as Jan and Tim mentioned, that is increasing, but we still see this huge focus predominantly on sort of the health impacts of climate change when we look at this literature. And I wonder, if you were able to talk, we've got a lot of people from different parts of the climate and health community on this call, where you think more attention might be needed, where the evidence gaps are that would be particularly helpful to drive the sorts of change that we'd like to see.
Oh, if I may, yeah, I think that's a very good question. I mean, I think I'm not surprised that the impact, the research on impact is much bigger than the adaptation mitigation part. But I think that we have to pay much more attention to the implementation and the social and the dynamics and economic dynamics around the inaction of what is known, and so how evidence makes its way to action. So I think that's a really important part that will also make better connection between the impacts and the adaptation side. And also, I think we have to help decision makers to show the impact on their programs and their actions. So they, at the end of the day, if we have to make evidence come back to us from what happened, who developed what, and what were the results, and what were the gains in health, which is challenging, but also it's an area that may help to bring virtuous or positive feedback loops into action. So I would say that these are like two areas that I would like to see more developed in terms of broad and cross-sectional research agenda.
Fantastic. Anna Maria, I don't know if you wanted to come in on this as well.
Yes, I fully agree with my colleague. I think that's really important to tie in these data. But I think it's also very important that we have use cases. So it's very important to know what actually happens and have descriptions from different parts of the world to show that that this can actually really happen in practice, and that also can convince our policymakers much more. Thank you.
That's great. And Jan, Tim, I don't know if you wanted to come in and maybe add a bit more to what you've previously spoken about on that.
Yeah, maybe very quickly. I think I already highlighted this. I think still rigorous evaluations of interventions is one important area. I think we also know it from the Lancet Countdown. If you look, because we have this kind of big finding on lots of impacts research, but in impacts research with proper attribution, that's still rare. So attribution studies are still very, very important to include. And we also, and I think that would be the third and last point that I would make here is research. We are not doing most of the research there where the people are most vulnerable to the impacts of climate change, and the co-benefits are also highest in terms of our interventions. So I think we still do most of the research where the money is, to put it in a nutshell. And I think that's not the best way of going on about it in an evidence in a world that should be evidence-based, in my view.
And just on that, Jan, because I know much less about the work you're doing on research funding. Based on what you're saying, I'm assuming that from that work, you're finding a very strong correlation between obviously where the funding is going and the types of research that's being produced. But I wonder if you're able to shed a bit more light on that relationship.
I mean, to be fully truthful here, that was an analogy, not from the climate and health data set. We are working on research funding on mainly in the field of carbon dioxide removal methods, but there we basically see that and this is the point I was making earlier, that the publication pattern that we find, the unequal publication pattern, is matched by an unequal funding pattern that is probably even more severe. And we haven't analyzed this in total depth, but the maps look quite similar, and I don't have any reasons to believe that this is fundamentally different in the space of health or climate and health.
That's great. So we haven't. So again, feel free to post any questions or thoughts you have on any of this, or feel free to raise your hand and we can just come to you. But while we wait for some questions to come in, I'll carry on. And one of the questions I have, particularly given Tim and Jan, the indicator that you produce is very much part of this larger work you're doing on evidence synthesis more broadly, but particularly in the climate and health field. And I wonder, one of the things I think we often don't necessarily reflect on is the role of indicators in this process. Like, what is it that we gain? We obviously lose something by having indicators in that it's not, you're not able to go into the same level of detail. But I wonder, from your experience of being now part of the Lancet Countdown for a few years, when people talk to you about the work you're doing there and producing an indicator, what you feel some of the strengths of that sort of work is versus some of the other work you're doing, or what grabs the attention?
I think it's in my view, this is really the Lancet Countdown is so successful because it can paint the big picture, and I think this is what people are also after. This is also what a lot of the other science assessments do, and they provide us with like almost like a bit of a compass for the rest of our work. And I think this is why it was when we had the opportunity to join the Lancet team, it was a kind of a no-brainer to do so, because I think it's this is really helpful for us to shape our thoughts, because unless you're sometimes forced to do these things, maybe you don't look at the data in the same way as you would if you produce such indicators. And I think it's also very helpful for us in terms of shaping future directions, because for me this is as you correctly highlight, this is just one way of looking at the data, and but it can also provide more value added as we work on these things for the Lancet Countdown, as I tried to understand, as I tried to outline in my intervention at the beginning.
Great, and we had a hand up from Tim to follow up on that, and then I'm just going to go to Anna Maria after that, because I think there's some interesting comments as well from her.
Yeah, I would also add to this. I think it's also a great starting point for people who want to continue this research. When we, especially in this context where we have such a big map, we of course do the big picture aspects, but we can also point out their research gaps or biases. Or, I mean, a gap could be a bias in a way, and give other researchers an opportunity to jump in this space when they see that gap, but also anyone who wants to do follow-up research on a more particular topic. We have done all the work to sift through the vast body of literature, and this is also tied to this interactive explorer that we built, and also as a follow-up the Big Destiny project, to enable researchers in very particular questions to say, hey, you annotated already all the health impacts for this particular health impact, give me all the research for that. And instead of them having to start the whole synthesis process from scratch, and start filtering and hit the ground running. And this speeds up the whole research community as a whole, and that's kind of also one motivation to keep this up to date and give these big picture findings so people are aware. And I think I'll leave it at that.
That's great, thank you, Tim. Anna Maria, you've mentioned that the report and the indicators can provide guidance and for agenda setting with regard to knowledge. I wonder if you might be able to say a bit more about
that. Yes, I can certainly try. Thank you. Well, we believe also, as has been said before, I think also by colleagues such as Tim, that a lot of research has been done over and over, and it doesn't provide any new insights. So we think that the scientific engagement indicator can really help and can be crucial for knowledge agenda setting and for people to do the research that is very needed. We found that in those settings where There's the lowest disease burden, for instance, for vector-borne diseases. Most of the research funds have been allocated there. And I think the Lancet Countdown report on climate change and health really provides this in a very insightful and visualized way. So that's very helpful also to guide research that's really needed, because those countries are also hit harder by the climate change in themselves. Over.
That's great. Thank you. Any questions for any of the panelists that those of you in the audience would like to ask? We have about 9 minutes. Well, actually less than that. Joseph Maria.
Thank you so much. I mean, fascinating session. So thanks a lot for organizing this. I think this is extremely useful. And my question for Tim and Jan is, I mean, I think you're very right to say, well, how this should be important for implementation, for taking decisions in funding in other areas. Well, so far, our gold standard, when you move from knowledge to implementation, is basically the systematic reviews, where you can grade the evidence, the quality of the evidence, using metrics and also consensus from experts. And how do you see the added value of this approach to the traditional systematic reviews? I assume that this is part of the role of Cochrane, you say, in Destiny, but where are you in terms of understanding the added value that you can provide to this type of initiatives?
I would say this is already kind of the added value by we provide the systematic map that is the starting point for downstream reviews. And also, I mean, these would be kind of in part kind of a transformation of the very traditional systematic review that goes through the entire pipeline itself. But if we, with the big picture systematic map, already provided part of that systematic review, that then can jump in and do the work, that would be the added benefit. And we can do this at a much bigger scale and kind of provide this across many different aspects that can be used as a starting point. But it's also an added value for evidence-based policymakers, because if they start asking questions when they want to develop a new policy, and they would have to first find the literature, and maybe this might not be complete or a not systematic approach, by us having gone through the systematic approach and painting the complete picture, it hopefully gives a more balanced starting point for policy or decision makers in general. Jan, do you want to add something?
Yeah, maybe just as Tim said, providing overview. I think that's one thing. Secondly, making the things that so systematic reviews faster, cheaper, and more useful. And more useful part is by providing additional, what we call them, data enhancement. You can think of it as additional metadata, so that stuff is found, for example, much more quickly. And then I think there's a research agenda, and we are only doing we are just starting to do work on this. Is also obviously accessibility of data, providing digital tools provide new opportunities to find also the stuff that you want to find much more quickly, and to interact with that and using this. But always, and I think that's the problem from my perspective, at the same standard that Cochrane was working, at the same standard that the Campbell collaboration was working. And I think that's something we all need to be concerned about, because we now get all these magical tools that promise you everything. They promise you the world. And if you look at them, they're not working. They're not evaluated. And I think that's something, I think we are also, at the moment of temptation as a research society, because things seem so nice and easy. But I think we need to just reapply our principles of rigor, and then we will be on a safe road and still can reap some of the benefits that those technologies bring us.
Yeah, I think a great point on the rigor, and just as an example on in terms of the speed and the use of the metadata with the global report this year, one of the comments we had from the central team once we produced the draft from Working Group 5 was, whether we could produce some data on authorship distribution as well as where the research was being produced, and I think within a couple of days Tim and Jan were able to come back with that data, so it's in the global report in terms of that disparity over who's also producing that research. We have a question in the chat from Catherine on how quickly does the big picture change? Should we be thinking about annual updates or something less frequent? This comes from this feel like I feel the energy of having worked on lots of Lancet Countdown reports coming there, and yeah.
I think I think our story is, the literature continues to grow rapidly. At the moment, obviously, we have 1 year where it's slightly less, but I think overall it's probably going to continue a bit like this. I don't know. But this is kind of very, very high level. I don't know. I mean, I find annual updates, I'm also contributing to another report that is updated roughly annually. And we are having the same discussion. Is it only, the substance that should drive us? So, for example, if it's really so substantial that we now need to report this new finding to the world, or is there a case of actually providing information to reassure people that this is still the case? And I think I would, if I interact with decision makers, my feeling is that there is a substantial role of this reassurance. And so I think it's really good for the Lancet Countdown to be there and at an annual basis. But maybe it wouldn't be too harmful if it was every other year. But I personally like it a lot, and I would even go further that our data on the for example, on the scientific indicator should be up to date at any moment in time, and I hope that we can that we also publicly provide this within the next year or so.
That's great, thank you. I'm gonna hand back to Catherine to wrap up, but I just wanted to thank Jan and Tim again. And I also just wanted to point out, just what an incredible resource it is that they've provided, not just, for the Lancet Countdown, but I think for the scientific community that works and focuses on the health and climate change intersection. It's such a huge resource. So thank you so much. And I'll hand over to Catherine.
So, well, thank you so much for joining us today for this webinar. We will be doing some additional capacity building activities going forward, where it gives us an opportunity to really engage more with some of the outputs from the Lancet Countdown, how they're developed, but also really how they get used. And how we can broaden participation in the production of the indicators. So yes, just to echo Nahir, thank you so much, Jan and Tim, and also Paulo and Ana Maria. It was really great to hear your perspectives, and I think it's been really thought-provoking to think about how we can be incorporating some of these ideas about, sort of moving more into this kind of living evidence model with some of the work that we do. So we'll close there. Again, thank you so much, and we hope to see you soon at our next capacity building event. So thanks very much.